Dental implant procedure. Today, we'll walk through the entire dental implant process with clear, step-by-step 3D animation. This guide is designed for patients, dental students, and anyone interested in modern dental care in the USA and Canada. Introduction. Dental implants are a leading solution for replacing missing teeth. This animation will show each stage of the procedure, from drilling to implant placement, support, and final crown installation. Pre-surgical assessment. Before surgery, your dentist or oral surgeon uses advanced 3D imaging, such as a cone beam CT scan, to evaluate bone density, nerve locations, and sinus position. This ensures precise planning and safe placement of the implant. A custom surgical guide is created to mark the exact location for the implant. Drilling and site preparation. The procedure begins with local anesthesia to keep you comfortable. The surgeon makes a small incision in the gum to expose the jawbone. Using the surgical guide, a pilot drill creates an initial hole in the bone. The site is gradually widened with a series of drills, each step carefully controlled to match the implant's size and depth. Throughout this process, sterile saline irrigation is used to cool the bone and remove debris, reducing the risk of overheating. Implant installation. A titanium dental implant, engineered with a special surface texture for better integration, is carefully threaded into the prepared site. The implant is positioned at the precise angle and depth determined during planning. The surgeon uses a calibrated torque wrench to ensure the implant is stable, which is crucial for successful healing. Healing and osseointegration. A healing cap or cover screw is placed over the implant to protect it. During the healing phase, the gum tissue is sutured around the cap. Over the next 3 to 6 months, the process of osseointegration occurs. Bone. Cells grow and fuse directly to the implant surface, creating a strong and permanent foundation. Crown attachment and final restoration. Once healing is complete and the implant is fully integrated, the healing cap is removed. A permanent abutment is attached to the implant, serving as a connector for the crown. A custom-made crown, matched in color and shape to your natural teeth, is secured to the abutment. The dental implant now functions and appears just like a natural tooth, restoring your smile and chewing ability. Dental implants are a highly effective, long-lasting solution for missing teeth. When performed by experienced dental professionals, success rates exceed 95%. For more information about dental procedures and to see more 3D animations, subscribe to our channel and explore our dental education playlists.